Hello everyone, my name is Amy Da Silva and today I'll be discussing methicillin-resistant Staphylococcus aureus, also known as MRSA. So what is MRSA? MRSA stands for methicillin-resistant Staphylococcus aureus. Staphylococcus aureus is a gram-positive bacteria that is resistant to the methicillin antibiotic. And right over there is a picture of MRSA being manifested on the skin. Staphylococcus aureus is a bacterium that was commonly known as staph. It was discovered in the 1880s and it commonly causes conditions known as scalded skin syndrome, boils, and impetigo, which is a contagious skin infection that causes pustules on the skin. Serious forms of S. aureus infection can even enter the bloodstream and become fatal. In the 1940s, the discovery and usage of antibiotic penicillin was made. During this time period, overuse or underuse caused mutation of the bacteria, pretty much the ability of the bacteria to grow resistance to antibiotics. In the 1940s and 50s, S. aureus developed resistance to penicillin, and this led to the development and administering of methicillin, which is another form of penicillin. Methicillin aided in the form of MRSA. In 1961, S. aureus became resistant to methicillin. This led to the creation of MRSA, what we now know as methicillin-resistant Staphylococcus aureus. The first case of MRSA occurred in 1968 in the U.S. Since then, more strains of S. aureus bacterium have developed antibiotic resistance, leading to the creation and administering of a wide range of antibiotics to treat MRSA. MRSA is one of the most common nosocomial infections. 5 to 10% of patients in hospital settings acquire it, especially patients with long durational stays in the hospital and chronic illnesses. And MRSA is also has a global effect in Australia, UK, Ireland, Southeast Asia. It's been known as a pandemic since it has a very big global effect. Transmission. MRSA can be transmitted either directly or indirectly. Directly amongst individuals whom have open wounds that are infected with MRSA and come in contact, or indirectly through contaminated surfaces such as airborne fluid droplets, faucets, towels, hospital settings, clothing, and sports equipment. MRSA can also be transmitted in hospital-acquired settings or healthcare clinical settings, or community-acquired through direct or indirect means. So what are the signs that you should look for to see if you have MRSA? It's very difficult to differentiate MRSA from a spider bite in the beginning since it looks very small, red, almost like a pimple. Later on, it develops into deeper grown, purulent abscess in the skin, as we can see on the right side. It can either stay in the skin or develop into other areas of the body, such as the bones, the joints, surgical areas, lungs, and the heart. So what are symptoms of MRSA? Redness, swelling, pain, warm to the touch, full of pus, usually accompanied with a fever or cellulitis, which is inflammation of the skin or the fat underneath the MRSA infection. So how do doctors diagnose MRSA? Doctors usually take tissue samples, nasal secretions, pus secretions, or urine samples, and they send it to the lab for microbiological testing to confirm the presence of S. aureus strand. That usually takes about 24 to 48 hours. So what kind of doctor can you go to for treatment? You can go to a primary care, internist, emergency medicine physician, or if the S. aureus spreads, you can go to a pulmonologist or a cardiologist if it spreads to the lungs or to the heart. Also, if MRSA spreads to the joints of the feet, orthopedic surgeon or podiatrist is necessary to see. High-risk groups include patients on dialysis, diabetic patients, IV drug abusers, healthcare workers, persons with chronic skin conditions, and HIV-infected persons. So how do I prevent myself from getting MRSA? It's important to wash your hands regularly, keep your skin lesions, abrasions, and burns covered up at all times, thoroughly clean your wounds, and do not share personal equipment such as razors, towels, or clothing. So how do I treat MRSA? So in the beginning stages, it's fairly simple to treat. Doctors usually use incisions or pus drainage to remove the bacterium from the area. If symptoms worsen, antibiotics are needed. And there are a wide range of antibiotics that are usually recommended depending on the strand of MRSA. So usually microbiological testing of the specific strand of bacterium is needed first before one administers an antibiotic. And the list of antibiotics include vancomycin, clindamycin, monocycline. So MRSA in the news today, recently in the month of June of this year, 2 drugs, TXA-709 and cefdinir, were known to have a very effective combination that are similar to the effects of penicillin, and they can be given outpatient or taken orally. They have less side effects, and phase 1 trials are expected to be conducted next spring in 2017. That concludes my presentation. Thank you all for paying attention and listening on how to prevent yourself from getting MRSA and what to do with MRSA. Thank you very much and have a great day.